Welcome to another edition of Sickle Cell with Dr. T. I am Dr. Adisoye, also known as Dr. T, and today we shall be talking about triggers of sickle cell crisis. I know a lot of warriors feel they know all the triggers of sickle cell crisis. Maybe you do, maybe you don't, or maybe you still have more to learn. You will know as you follow up with this lecture. But before I talk about triggers, I want to talk about sickle cell crisis. What is sickle cell crisis? Sickle cell crisis is that pain. It isn't emotional pain now. Physical pain. That pain people with sickle cell disease feel as a result of the sickling process is called sickle cell crisis. The pain that results as a result of the sickling process of sickle cell disease is called sickle cell crisis. One of these days we'll talk about the pathophysiology of sickle cell disease, where we'll be able to discuss the sickling process in details. Although we will mention some things today, but we won't go into core details. Before talking about triggers, I also like to talk about the nature of a crisis. What is a crisis like? A crisis can be mild, moderate, or severe. And severity now has grades. The intensity differs. No two pain has the same intensity. Even in the same person, the intensity of your crisis today will not be the same intensity of your next crisis. Intensity is never the same. So it can be mild, moderate, or severe. It can start suddenly or insidiously. You know, you can be playing right now, and this moment, and the next moment you are down with a severe crisis. That is a sudden onset. For insidious onset, sometimes we have auras, we have warning signs. Some people feel fatigue ahead of crisis. Some people feel numbness of lips. Some people feel mild generalized pain before they have a serious crisis. So that is an insidious onset. A crisis can also end suddenly. It can end suddenly or insidiously. And that's why sometimes for the insidious ending, sometimes when your crisis gets better, when the pain is going, it takes days for it to go totally. That's the one that goes insidiously. And there are crises that will stop on the spot. They will just end like that. We also have the character of the pain can be sharp, dull, colicky, depending on where the pain is located. And the sickle cell crisis pain can be located anywhere that blood flows, your hand, your chest, your buttocks, anywhere. You can have sickle cell crisis anywhere. Also, sickle cell crisis can last for hours, can last for minutes, can last for days, can last for weeks, can last for months. And those that usually last for months are usually recurrent. The pain will go and come, go and come. You can see a sickle cell warrior being hospitalized for months. And some can just last for minutes. You can see that sickle cell is that diverse. The way it presents is different. So you can't be saying because this pain, this girl was fine now, how come she's now in pain, she's malingering, she's faking? No, you can't say someone is faking because their pain started suddenly, because they seemed to be fine an hour ago. It doesn't mean they are still fine. Sickle cell works like that. Or maybe someone's pain just ends abruptly and you say, this one was just seeking drug. This one was just seeking drugs. This person was just faking. This person was just malingering. If you don't know what sickle cell crisis is, you can't judge it. So that's why I'm taking my time to analyze what the nature of a crisis is like too. About triggers of sickle cell crisis. Triggers of sickle cell crisis are things you can do that can precipitate a crisis. There are many common ones that people know. There are common ones that people know and easily talk about, but there is this particular one that I don't hear so often, and that is why I will always say the number one trigger of sickle cell crisis is nothing. Yes, you heard me right, nothing. You don't have to do anything to have a crisis. As much as you can do things that can trigger crisis, you still don't have to do anything to have a crisis. It can happen, a sickle cell crisis can happen with or without your help. And we all know, I won't talk much about, I won't go deep into pathophysiology, but I'll still say some things so that I can elaborate about the sickling process. The sickling process is a self-enabling process. And when we want to talk about the sickling process, we say, okay, when the red blood cells are exposed to low oxygen tension, that they polymerize and form tactoid or gels, become rigid and sticky, obstruct blood flow, blood vessels, causes pain and causes organ damage, and the likes. You can expose yourself to low oxygen tension actually. If you, for example, if you live in area of high altitudes, if you travel in unpressurized aircraft, if you do these things, you can expose yourself to low oxygen tension. But even without these things, low oxygen tension can happen. And this is why your circulatory system, the normal circulatory system of every human being, there is this, every organ in every human being functions with the use of oxygen. So, as oxygen is taken from the lungs, it is taken to the heart. And then to the organs that need the oxygen. After the oxygen is delivered, the blood becomes deoxygenated. And when this happens, red blood cells of people living with sickle cell disease sickle because of low oxygen. So with or without you exposing yourself to low oxygen tension, the normal circulatory system will make it happen. It will sickle. And when the blood is trying to be reoxygenated back in the lungs, getting reoxygenated back in the lungs, some of the sickle red blood cells will get reversed back. But after consecutive sickling, after frequent sickling, many will become irreversibly sickled. And that is just one of them. There are, apart from that I have mentioned, the sickling process does many other things. That sickled red blood cells, let me tell you, I will just mention those things it does that make it self-enabling. It damages the endothelium, causing it destroys vasculopathy, destroying blood vessels, causes oxidative stress. It activates inflammation. The sickling process activates inflammation. The sickling process causes platelet activation. It causes coagulopathy. When blood coagulates, it causes coagulopathy. It adheres to leukocytes. The damaged sickled red blood cells adheres to leukocytes, causing leukocytosis. So it also causes vasoconstriction because nitric oxide is lost in the process of frequent hemolysis during the sickling process. We'll talk about this in details when we're talking about pathophysiology of sickle cell disease. Because sickle red blood cells are fragile, their lifespan is about 10 to 20 days instead of 90 to 120 days. They break down so easily. So the frequent breakdown causes it to lose nitric oxide in the process. Nitric oxide causes vasodilatation. So the sickling process also causes vasoconstriction because there is no enough nitric oxide to be delivered to tissues, to peripheral tissues due to the sickling process. So see all the factors that the sickling process causes. It causes vasculopathy, leukocytosis, it activates inflammation, it causes vasoconstriction, and all these things it causes now enables and promotes sickling. So they make it a cycle. Thrombosis will promote sickling, vasoconstriction when the vessels are becoming constricted, it will promote sickling. When there's blood coagulation, it promotes sickling. That's coagulopathy. When there's infection, leukocytosis. When there's increased white blood cells, it promotes sickling. So with or without anybody's help, the sickling process will happen. That is why you should not expect, you should stop blaming warriors and asking them, what did you do that made this crisis happen? Did you stress? Yes, you could stress yourself, but you might do absolutely nothing and have a serious crisis because it is a process that does not even need you to happen. These are things that you cannot necessarily control. The few ones you can control them. So let's talk about other things that can help a crisis to occur, other things that can trigger a crisis. Extremes of temperature, trigger crisis. It is not only cold that triggers crisis. A lot of people will just mention cold. It's not only cold. Cold causes vasoconstriction too. So it's not only cold that triggers crisis. It will trigger crisis too because it causes dehydration. Do you get? We have acidosis also triggers crisis because it causes a shift in oxygen dissociation curve. It triggers crisis. Dehydration. If you don't take enough water, you have a crisis. So every adult living with sickle cell disease should at least take 3 liters of water a day. And for children, you should take 100 to 120 ml per kg per day. When I say 100 to 120 ml per kg per day, if your child is 20 kg, multiply by 100. Let's take 100. Multiply by 100, that's 2,000. 2,000, that's 2,000 ml, which is equal to 2 liters. So your child needs to take 2 liters of water a day. If your child is 20 kg, so you multiply it like that, whatever the weight of your child is, to know the amount of water your child needs to take a day. Alcohol causes dehydration. Although it's a drink, but it causes you to urinate a lot. It causes diuresis, so it will eventually cause dehydration. So alcohol intoxication can trigger a crisis. Smoking triggers acute chest syndrome. Apart from causing so many other things like lung cancer, smoking can trigger sickle cell crisis. So those are some vices you should stay away from. Infections like if you have an infection, if you have malaria, if you have a simple respiratory tract infection, treat it. If you don't treat it on time, it can trigger a crisis. Stress is one of the most important triggers of sickle cell crisis. Exercise, physical exertion. Yes, exercise is good, but in sickle cell, some people will say, exercise is good for sickle cell warriors, you should exercise. In sickle cell, what is good for this goose is not always good for the gander. Yes, exercise is good, but the exercise that each sickle cell warrior can tolerate differs from one person to another. There are some sickle cell warriors that can only tolerate walking for 10 minutes. That's the exercise they can tolerate, or else they have crisis. But we have warriors that do sports, and they do it well. So you have to study your body. You have to know what you can tolerate. So when you're doing exercise, and something that you should do often is you should take enough water, and you should rest in between exercise. And when you feel extreme pain or difficulty in breathing or pain, stop that exercise that moment. So when it comes to exercise for sickle cell warriors, it's not every warrior that can tolerate exercise. You should always remember that. And there are some avoidable triggers, and there are some unavoidable triggers. Some unavoidable triggers will include menstrual cramps, pregnancy. Pregnancy increases vaso-occlusive episodes. You have more crises during pregnancy than when you're not pregnant. It increases rates of infections. Infections like UTI gets increased during pregnancy. So pregnancy is a trigger of sickle cell crisis, but that's not an unavoidable trigger. You have to manage. That's why we advise for preconceptional care. If you want to get pregnant, get preconceptional care, get antenatal, good antenatal and postnatal care. Many warriors have children and they are fine, but you have to get good care beforehand, during and after pregnancy. Sex triggers crisis, but it is not general. Some people will tell you sex does not trigger their crisis, but for some people it triggers their crisis. Nothing is generalized in sickle cell disease, actually, not even triggers. So this will trigger for A and it will not trigger for B. Surgical operations, surgical procedures, dental procedures, all those can take necessary precautions before taking these procedures because they can trigger crisis. Living in area of high altitude, like I mentioned, cause hypoxia because low oxygen tension. Traveling in unpressurized aircraft. Emotional triggers. Yes, people don't talk about emotional triggers enough. Your emotions, the state of your emotions can trigger crisis for you. Panic attack, fear, anxiety, sadness, depression, overexcitement. They can trigger sickle cell crisis. So you have to, sickle cell warriors have to be in control of their emotion. When you have kids that cannot talk, that cannot express themselves, then you should study them, or anything that scares them. Don't expose them to it because it might trigger crisis and they will not even be able to tell you. Anything that scares them, like or watching horror movies or some other, anything that scares them. When they get older, they will be able to say, okay, I don't get crisis when I watch horror movies, so I can watch it. They will be able to tell you. They will be able to judge what doesn't affect them and what affects them. When you have comorbidities, when you have sickle cell with other conditions, like if you have sickle cell disease and you have diabetes, you have to manage your diabetes well, use your medication, because an escalation in the other condition will trigger crisis for you. And we also have idiosyncratic causes. These are triggers that are peculiar to warriors. You will hear some people tell you this thing triggers my crisis, and you'll be like, what? It's really very weird. There are some triggers peculiar to people, and when they say, don't say they are lying. They know what they are talking about. The fact that it doesn't affect you doesn't mean it does not affect them. I don't know if there's any other trigger that we've not mentioned. Hopefully, if there's any one that I've forgotten to mention, I'll probably add it on the video. Anyways, it's been nice talking about triggers of sickle cell crisis. I hope you enjoyed the teaching, and I'll see you next time. Don't forget to subscribe to my YouTube channel. Bye.